Namaskar, I am Dr. Shayan Chakraborty, consultant infectious disease from Amri Hospitals, Mukundapur. Right now, we are going through a certain phase where people are having different types of symptoms like fever, cough, and the cough is for a long duration, 7 days, 10 days of cough. And most of the times, we are seeing that children are really suffering this time. It was not the same case with COVID. COVID had actually spared the children. Very few cases were there definitely, but this time children are suffering really bad, and we have to keep in mind that this is going on for quite some time. And since the children are going to school, and for last 2 years the schools were closed and they were not exposed to other children in schools. So whenever children go to school, so there is some kind of infections that goes on, milder infections, and that boosts our immunity. So that didn't happen, and this time when the children are going to school and there is a certain virus that we all know, that's the adenovirus that's circulating around in our Kolkata and surrounding areas. So probably a new strain has come up which is more virulent, like more infective, causing more illness, and children do not have that kind of immunity to fight that particular virus. So the important thing is that definitely they will go to school, but if they're ill, if they're having a fever, cough, or they're sneezing, it's better to keep them at home, consult your pediatrician, and do whatever he or she says, take the medicines. And the ones who are healthy, who are going to school, they can at least use a surgical mask. You can always motivate them to use a mask like we did last time during the COVID, and we defeated COVID with mask and hand sanitizers. So similarly this time is the same thing. Surgical masks are good enough to stop this particular virus, so they can use that. It's even applicable for the adult, because many adult people, mostly the elderly who have got comorbidities, they are also coming to us with different kind of viral or bacterial illnesses, the same respiratory route through which it is entering. It can be influenza, parainfluenza, metapneumovirus, bacterial infections like Streptococcus pneumoniae, H. influenzae. So different, altogether different kind of organisms we are seeing in elderly. So definitely adults who are going out of their home to their offices or marketplaces, which are definitely more crowded, so they should wear the surgical mask at least and carry the sanitizer around with them. So by this we will be able to defeat this particular illness, the respiratory illness that is lingering for quite some time, because now the winter is almost gone. So this virus are supposed to get suppressed by now, but it's not happening. So we will not wait for the summers to come up and save us from this. Definitely we have to take the responsibility in our own hands, and we should all be together in this. There's no need to panic as such. So if there is a certain illness, especially among children, if there is a fever, if the child is crying, if this child is vomiting, if the child cannot breathe properly, definitely take the kid to some hospital. Maybe the kid needs to be admitted, maybe the child will require oxygen therapy or even in the ICU care, but don't panic. The children are getting better, they are going back home and doing like well in their life. So it's nothing to panic about that, but you need to be well aware that what needs to be the red flag signs for that, to take the kid to the hospital. Always be in contact with your pediatrician and follow his or her advice. So this is what I want to say. Thank you so much.